You wake up in the middle of the night with a strange feeling in your chest. It is not the sharp, stabbing pain you see in movies. It feels more like a heavy pressure, like someone quietly sitting on your sternum. The discomfort creeps into your left arm or your jaw. You feel a little nauseated, a little short of breath. You tell yourself it is probably indigestion or maybe anxiety. You think, let me wait 5 minutes and see if it passes. Those 5 minutes can be the most dangerous of your life. A heart attack does not always arrive as drama and shouting. Very often it arrives as doubt. Doubt makes people wait. Waiting lets heart muscle die. And when you are alone, the temptation to wait is even stronger because you do not want to bother anyone. You do not want to seem dramatic. You do not want to call an ambulance for nothing. This video is not about fear. It is about preparation. I want to guide you calmly and clearly through 3 life-saving steps you can take if you ever suspect a heart attack while you are alone. 3 decisions that can make the difference between walking out of a hospital or never getting there. Before we talk about the steps, you need one mental picture. A heart attack happens when blood flow to part of your heart muscle is suddenly blocked. Usually, a clot forms on top of a narrowed artery. That piece of heart muscle starts to suffocate. Every minute without enough blood means more cells dying. Once they die, they do not come back. That is why time is not just important in a heart attack. Time is muscle. Saving minutes saves heart tissue. This is different from cardiac arrest. In cardiac arrest, the heart stops beating effectively and you collapse, unconscious. That is when someone else has to start chest compressions and use a defibrillator. In a heart attack, you are usually awake. You feel pain, pressure, or other strange symptoms. You still have a chance to act for yourself. That is the window this video is about. The first step is simple to say and hard to do. The moment your body and your intuition tell you this could be a heart attack, you must decide that it is an emergency and act as if it is. Heart attack symptoms are not always textbook, but there are patterns. The classic picture is pressure, tightness, or pain in the center or left side of your chest that lasts more than a few minutes or comes and goes. It can feel like squeezing, fullness, burning, or a heavy weight. The discomfort may spread to one or both arms, to the back, to the neck, to the jaw, or even to the upper stomach. You may feel short of breath even when you are not moving. You may break out in a cold sweat. You may feel unusually tired, dizzy, or nauseated. In many women, older adults, and people with diabetes, the signs can be more subtle. They may notice sudden weakness, pressure in the upper back, discomfort in the jaw, a strange feeling in the chest, or breathlessness without obvious chest pain. Sometimes it feels like bad indigestion that does not improve. The important point is not to memorize every possible symptom. The important point is to recognize when your body is sending an alarm that does not match your usual patterns. You know your own normal better than anyone else. If you are sitting quietly and suddenly feel a heavy, unfamiliar pressure in your chest, or a wave of breathlessness or pain in your chest and arm, you do not need to debate for an hour whether it meets some perfect checklist. You need a rule that is simple enough to use when you are scared. A useful rule is this: if you have unexplained chest discomfort or upper body discomfort that lasts more than a few minutes or that keeps coming back, especially with shortness of breath, sweating, or nausea, treat it as a heart attack until a professional proves otherwise. This means you do not tell yourself, "I will wait and see," for half an hour. You do not walk around the house to test if it gets better. You do not get in your car to drive yourself to the hospital hoping it will pass. You accept that you may feel embarrassed later if it turns out to be something less serious, and you decide that embarrassment is a small price to pay for staying alive. That decision is step 1. Decide quickly that this is an emergency. Do not minimize it. Do not negotiate with it. You can apologize to the paramedics later if it was a false alarm. Your heart does not get a second chance. Step 2 is to call for professional help in the fastest, safest way you can. When you are alone, this means reaching for your phone immediately and dialing your local emergency number. For some people, that is 911. For others, it is 112-999-00-123 or another local code. Whatever it is where you live, your phone should already know it. Program it, write it near your landline, save it on your mobile. When you suspect a heart attack, the emergency call is your first action, not your second or third. You do not call your family first. You do not call your neighbor first. You do not search the internet for what to do. You let trained dispatchers and medical teams enter your story as early as possible. If you are using a mobile phone, put it on speaker mode as soon as the operator answers. Say clearly where you are, including apartment number, floor, nearby landmarks if needed. Then say something like, "I am alone and I think I am having a heart attack. I have chest pain and I feel short of breath." You do not need to sound calm or clever. You only need to be honest and direct. Stay on the line unless they tell you it is safe to hang up. They may guide you through what to do while you wait. They may ask you to unlock your door if you can. They may ask about medications you take or conditions you have. Answer as best you can, but remember, their first priority is to send help. Your job is to let them. If your symptoms start while you are driving, do not try to push through to your destination. Signal, slow down, and pull your vehicle safely to the side of the road. Turn on your hazard lights. Once you are stopped, call the emergency number from inside the car. Unlock the doors if you are able. You do not want to lose consciousness while a moving car is under your control. Many people are tempted to drive themselves to the hospital or have someone else drive them instead of calling an ambulance, especially if they worry about the cost. But an emergency medical team can begin treatment on the way, monitor your heart rhythm, give oxygen and life-saving medications if needed, and warn the hospital before you arrive. Driving yourself when you might collapse at any moment is far more dangerous to you and to others on the road. If there is any way for an ambulance to reach you, that is the safer path. So step 1 is deciding that this is an emergency. Step 2 is calling for help immediately and clearly. Now we come to step 3, protecting your heart and your safety while you wait for help to arrive. Once you have called, you do not pace the room. You do not climb stairs. You do not gather belongings for a suitcase. You focus on staying as still, safe, and calm as possible. The goal is to reduce the burden on your heart while blood flow is compromised. If you are standing, sit down on the floor or on a firm chair. If you feel faint or very weak, it can be safer to sit on the floor with your back against a wall or piece of furniture than to sit on a high stool or narrow chair where you might fall. If you prefer to lie down, do so on your back with your head and upper body slightly raised using pillows, or lying on your side if breathing feels easier that way. Choose a position where your chest feels the least strained. If you can reach a door without exertion or climbing stairs, unlock it so paramedics can enter quickly. If you have a chain lock, open it. Turn on an entry light if it is at arm's reach. If your home is hard to find and you can see the street from a window near where you are resting, you can leave a light on or open a curtain to make it easier for them to locate you. Do only what you can without making your pain or breathlessness worse. Loosen any tight clothing around your chest, neck, or waist. A belt or tight collar is not causing the heart attack, but feeling restricted can make breathing more uncomfortable and add to panic. Take slow, gentle breaths through your nose if you can, and out through your mouth. You are not trying to breathe deeply for a long time. You are trying to avoid hyperventilating from fear. Think of your breath as a signal to your nervous system that you are still here and still cooperating. If you have been prescribed nitroglycerin for chest pain in the past, and your doctor has told you exactly how to use it in situations like this, follow that plan while you are on the phone with the dispatcher unless they tell you otherwise. Place the tablet under your tongue or use the spray as directed. Do not take someone else's nitroglycerin. Do not take extra doses beyond what your prescription allows. You may have heard about taking aspirin during a heart attack. Aspirin can help reduce blood clotting and is often part of treatment in the hospital. However, guidelines in many places now emphasize that you should never delay your emergency call in order to take aspirin. Call first. If the dispatcher or an emergency professional who knows your history tells you to chew an aspirin and you are not allergic to it, you can follow that instruction. If your own cardiologist has given you a written plan that includes aspirin when symptoms start, you can follow that plan while you wait, as long as it does not delay your call. Do not invent your own medication cocktail in the moment. Do not take aspirin if you know you are allergic to it, if you have been told to avoid it because of bleeding or other conditions, or if an emergency professional tells you not to. Do not take random pills from your cupboard because you saw a post about them online. Medications are powerful tools and can also complicate what doctors need to do when you arrive. While you wait, have your identification nearby if possible. If you keep a list of your medications, diagnoses, and allergies, place it where responders can see it, such as on a table or on the refrigerator. You do not need to get up and search if it means stressing your heart. But if it is already within easy reach, it can save precious seconds later. If you live in an apartment building or gated community, and you have a close neighbor or concierge you trust, you may, after calling emergency services, send them a brief message or call saying, "I have chest pain, an ambulance is coming, please be ready to guide them to my door." Do not do this instead of calling the emergency number. Do it afterward if you still feel capable and if it does not require major effort. Their role is to open doors and guide, not to diagnose or treat you. As you sit or lie there, you may feel fear rush up. Thoughts may appear. What if no one finds me? What if this is the end? This is a human response. It does not mean you are weak. But strong fear can spike your blood pressure and heart rate, which is the opposite of what you want. One way to help yourself is to focus on the next small action instead of the big unknown. You can tell yourself out loud if you want. "Help is on the way. I have called. My job now is to be as still and calm as I can." You can count your breaths up to 10 and then start again. You can visualize your heart being supported by the medicines and equipment that are already being prepared for you. You are not alone anymore. The moment you made that call, you placed yourself inside a chain of care. There is one more important point to cover while we are in step 3, because it is a myth that refuses to die on the internet. You may have seen posts about cough CPR that claim you can save yourself during a heart attack by coughing repeatedly and forcefully. These messages are misleading and can be dangerous. Major heart organizations do not recommend cough CPR for a person who thinks they are having a heart attack alone. In a true cardiac arrest, when the heart has stopped and you collapse, you cannot cough. And in a typical heart attack where you are still conscious, forcing yourself to cough instead of calling emergency services can waste crucial time and even make things worse. So if you suspect a heart attack and you are alone, your 3 steps are not cough, cough, cough. They are decide, call, protect. Decide it is an emergency. Call your local emergency number. Protect your heart and safety while you wait. Now I want to bring these steps to life with a few brief stories so you can see how they play out in the real world. Imagine a man named Robert, 68 years old, who lives alone. It is Sunday morning. He is washing dishes when he feels a band of pressure around his chest. He tells himself it is probably the way he slept. He keeps going. A few minutes later, the pressure is still there, and he feels sweat on his forehead, even though the kitchen is cool. He remembers a video he once watched about chest pain, but his first instinct is denial. I do not want to make a fuss, he thinks. He sits down, drinks a glass of water, and waits. The discomfort does not go away. It creeps into his left arm. Now he feels a bit sick to his stomach. 10-15 minutes pass. He has not called anyone because he is still hoping it will disappear. By the time he finally decides to ask for help, his heart has already lost precious muscle. He survives, but his recovery is harder and longer than it needed to be. Now imagine the same moment with a different decision. Robert feels the pressure, the sweat, the nausea. He remembers a simple rule he decided on after a checkup. If I have chest pain that is new and scary and lasts more than a few minutes, I will call emergency services, no debate. He does not enjoy the idea. He is afraid of overreacting. But he follows the rule he made for his future self. He grabs his phone, calls the emergency number, sits on the floor by the door with a pillow behind him, unlocks the lock, and breathes. Paramedics arrive while his heart muscle is still salvageable. At the hospital, doctors open the blocked artery in time to limit permanent damage. He apologizes to the team for bothering them. They tell him he did exactly what he needed to do. Now think of Maria, 71, who has been told she has risk factors for heart disease. Her doctor has encouraged her to create a heart emergency plan at home. She has written down her medications, allergies, and diagnoses on a card by the phone. She has saved her local emergency number as the first contact on her mobile. She has had a conversation about aspirin with her cardiologist and knows exactly when she should take it and when she should not. She has told her neighbor where the spare key is, just in case. One evening, she feels a strange pressure in her chest and jaw while watching television. It is not sharp, but it is wrong. Because she prepared, she does not spend 30 minutes searching online, and she does not wait to see if it will go away. She moves to a comfortable chair near the front door, calls the emergency number, and explains what she feels. She follows the dispatcher's instructions about her prescribed nitroglycerin and aspirin. She places her list of medications on the table. By the time the ambulance arrives, her heart has not been left to struggle alone. She used the 3 steps almost automatically because she had rehearsed them in her mind. Finally, picture someone like you. Maybe you are over 60. Maybe you live alone. Maybe you have known for years that your risk is not 0. You are watching this not during a crisis, but on a calm day. This is the best time to build the habits that can save you on a chaotic day. You can start by making a personal rule about symptoms. Decide now what threshold will trigger your emergency call. For example, if I ever feel new chest pressure, discomfort in my chest and arm, or sudden unexplained shortness of breath that lasts more than 5 minutes, I will call my local emergency number even if I am not sure it is a heart attack. Write this rule somewhere visible. The goal is not to create anxiety. The goal is to remove hesitation later. You can also prepare your environment. Teach your phone to cooperate by adding the emergency number to your favorites or home screen. Create a simple card with your name, address, emergency contacts, medications, doses, allergies, and medical conditions, and place it near your main resting spot and near the door. If you use a smartwatch or smartphone with emergency features, learn how to call for help with a button press or voice command. If you share building access with a trusted person, agree on how they can help paramedics reach your door quickly if needed. Talk with your healthcare provider about your individual heart risk. Ask whether you should keep nitroglycerin or other medications at home and how exactly to use them. Ask whether taking aspirin at the start of symptoms is recommended for you, and under what conditions it is not. Write down the answers. The middle of a heart attack is not the time to improvise or rely on vague memories of what someone said years ago. One more layer of preparation that many people overlook is learning CPR, not for yourself, but for others. If you attend a class, you will learn the difference between heart attack and cardiac arrest, how to recognize when someone has collapsed and is not breathing normally, and how to start chest compressions while someone else calls for help and brings a defibrillator. Knowing what others can do for you if you ever collapse in public can also ease some of the fear you may carry. You are building a community of skills around you. At this point, you might wonder, where does lifestyle fit in? Shouldn't we be preventing heart attacks instead of planning for them? Of course we should. Healthy food, movement, sleep, stress management, and medical treatment for blood pressure, cholesterol, and diabetes all matter. But prevention and emergency planning are not opposites. They are two sides of the same respect for your life. You can work every day to lower your risk and still accept that if a heart attack happens, you want to be the person who knows exactly what to do in the first minutes. If I had to compress everything we have discussed into one clear line for you to remember, it would be this. If you are alone and you think you might be having a heart attack, do not wait, do not search, do not drive. Decide it is urgent, call your emergency number, and then stay as still and calm as you can while help comes to you. Those are your 3 life-saving steps. They do not require medical training. They require courage, clarity, and a bit of preparation. You are not too old to learn them. You are not too late to practice them. Whether you are 60, 70, or 85, your heart is still working every second to keep you here. The least you can do in return is learn how to protect it in its hour of need. As you finish this video, take a moment to choose one action you will do today. Maybe you will program your emergency number into your phone. Maybe you will write a simple information card for your fridge. Maybe you will talk to your doctor about your personal plan for chest pain. Maybe you will share this video with someone who lives alone and has never thought about what they would do. Whatever you choose, let it be a step that tells your future self, I cared enough about you to get ready. Because if that day ever comes, and you are alone with a strange pressure in your chest, you will not have to invent a plan in panic. You will already know, decide, call, protect. And that knowledge can be the bridge between fear and survival. If you want to keep exploring calm, science-based ways to take care of your heart, your brain, and your vitality in this stage of life, you can stay close to this community. You are not just counting years. You are learning how to live them with as much strength, awareness, and hope as your body will allow.